presentation that I'll be speaking about today has to do with a less common type of lymphoma called peripheral T-cell lymphoma. And this has been a continuing challenge for clinicians and patients for the last 20 to 30 years since these entities were well described. And the bottom line is that these patients do not do well with standard treatments that have been borrowed from the treatment of B-cell lymphoma. So there has been a search for an approach that would allow the use of something that would be an improvement on the basic recipe. So we know that agents such as cyclophosphamide, doxorubicin, and prednisone are of some usefulness, but limited usefulness for the peripheral T-cell lymphomas. And the promise has been brought forward with the new agent, Brentuximab Vedotin, which is an antibody targeted against CD30, but it's an antibody drug conjugate, and so the antibody carries an effective agent to the vicinity of the cells that express the CD30, and it is a potent agent for any cells that express CD30, and may be a potent agent even for malignant cells that are in the vicinity of cells that express CD30. That said, there is an adequate rationale to think that substituting the brentuximab into the basic recipe of cyclophosphamide, doxorubicin, and prednisone instead of the agent called a vinca alkaloid, which was in there previously, vincristin, might lead to an improved outcome. The exciting thing about the abstract that I'm referring to is that this has turned out to be a positive study and indicates a major step forward in the management of patients with peripheral T-cell lymphoma. So the bottom line is that after a long wait of decades, this may be a step forward in the treatment of this substantial but less common variety of lymphoma that's lacked effective treatments in the past. It was a large study done internationally, and one of the challenges with peripheral T-cell lymphoma is that it is a disease that actually comes in multiple different forms, requiring careful hematopathologic classification. And as a result, there's always been a concern that there would be differential effects across these different types. This is a large enough trial that they were able to include substantial numbers to represent the most common varieties of peripheral T-cell lymphoma, and the results seem to be shared across the different varieties, and so it should be one that can be extrapolated to the whole group.